As the name indicates, it is cuboidal in shape. It lies anterior to the calcaneus bone and behind the fourth and the fifth metatarsals. The cuboid bone is one of the major bones in the midfoot because it has many articular surfaces. The first bone in the distal row is cuboid. The cuboid articulates with four bones of the foot, the calcaneus bone posteriorly, the lateral cuneiform medially, the fourth metatarsal anteromedially, and the fifth metatarsal anterolaterally. Sometimes there is a presence of fifth facet for the articulation with the navicular bone, which forms a joint, the cubonavicular joint. The likelihood is increased in overpronated feet. One of the very important functions of this bone is it acts as a pulley for the peroneus longus muscle. The cuboid has 6 surfaces. Let's discuss them in detail. So the first we have the dorsal surface. It is rough, directed upward, having facet for attachment of calcaneus, and lateral providing attachment of ligament. The plantar surface has a cuboidal tuberosity on which peroneal sulcus is present for the tendon of peroneus longus muscle. The lateral surface, it has a deep notch or depression, which is a groove for fibularis longus muscle. This notch is present at the beginning of the peroneus sulcus. The posterior surface, it is smooth and triangular, providing attachment with the anterior surface of the calcaneus. The anterior surface is smaller and irregularly triangular. It is divided into 2 vertical ridges. The first one is the medial quadrilateral ridge, which articulates with the fourth metatarsal, and the second one is the lateral, larger and more triangular, which is going to articulate with the fifth metatarsal bone. The medial surface, it is broad, irregular and quadrilateral in shape. A smooth oval facet is present at its upper part. It provides articulation with the third or the lateral cuneiform. Behind this, there is a smaller facet for the articulation with the navicular bone. The cuboid bone and the 3 cuneiforms. They help in the formation of the distal row of the tarsal bones. Now talking about the cuneiform bones, they are a set of 3 bones located on the medial side of the foot. They are wedge-shaped and are going to articulate with the navicular bone in the proximal direction and with the first 3 metatarsal bones in the distal part, and also articulates with the cuboid bone on the lateral side. This wedge shape of these bones help in the formation and maintenance of the transverse arch of the foot. Talking about the individual bone, so first we have the medial cuneiform. It unites with 4 bones, which are the navicular bone, the second cuneiform, the first and the second metatarsal bones. Now we will discuss the surfaces of the medial cuneiform. So first we have the lateral surface. It has a piriform facet on the proximal side that provides articulation with the navicular bone. A small facet is also present on the lateral surface that provides articulation with the second metatarsal bone. The intermediate cuneiform has a Lisfranc ligament, which is a pivot ligament that provides foot stability. Talking about the anterior surface, it is kidney-shaped and articulates with the first metatarsal bone. It has a drive for the attachment of the tendon of tibialis anterior. The intermediate cuneiform is the smallest bone among all the 3 cuneiform bones. It has a greater number of smooth surfaces, which differentiate it from the other cuneiform bones. It also forms joints with 4 bones, the navicular, the first and third cuneiform, and the second metatarsal bone. Proximally, there is an articulation for the navicular bone. And distally, we have an articulation point for the base of second metatarsal and the medial cuneiform bone. The interosseous ligaments attach to the non-articular surfaces that attaches it to the other cuneiform bones. The lateral surface articulates with the lateral cuneiform. The lateral cuneiform is identical to the intermediate cuneiform. It also has a rough rectangular wedge. This lateral cuneiform attaches with 6 bones, which are the navicular, this second cuneiform, cuboid, second, third, and fourth metatarsal bones. The lateral surface of the lateral cuneiform bone has a triangular insertion point for the cuboid bone, and triangular insertion for the third metatarsal and the fourth metatarsals. Two small facets for navicular bone are present on the distal aspect of the medial surface. An indented vertical strip is also present on the medial surface, which is created by intermediate cuneiform. You can memorize the tarsal bones because they resemble certain shapes. The talus bone resembles the snail. The calcaneus looks like a bit of a rectangular shape like a tree trunk. The navicular bone resembles the boat. The cuboid is cuboidal in shape, and our little cuneiform bones resembles the wedge shape. So this was all about the anatomical landmarks of the tarsal bones. I hope you have understood every detail of them. Let's now move ahead towards the muscular and the ligamentous attachments.